More than 100 COVID-19 patients are in local intensive care units right now.
To try to ensure that we have enough hospital space moving forward, Governor Greg Abbott issued a new executive order. It limits elective surgeries in the 4 biggest counties in Texas. He did something similar back in March. That time it applied to all medical providers. He eased those restrictions in April.
KXAN's Eugene Cho found out how this new order will impact hospitals already hit hard by the pandemic.
It was devastating for most medical practices and hospitals.
Dr. Austin Hill at Texas Orthopedics says the March executive order stopping elective surgeries put many hospitals in a difficult financial situation.
Yeah, one of the largest revenue drivers for hospitals is surgery. Because physician practices aren't typically keeping a lot of cash or capital to invest in other things, they're vulnerable to cash flow disruptions.
The American Hospital Association recently looked at how much hospitals were spending to treat COVID-19 patients, how much they were losing through canceled surgeries, and how much they were spending on personal protective equipment. The association then estimated hospitals across the country were losing $50 billion a month between March and June. Hill says after the surgery limitations lifted in April in Texas, his practice has been able to rehire people. This new order, he says, will not be as detrimental, impacting less than 10% of orthopedic surgeries. That's because of the last sentence that mentions not interfering with hospital capacity.
So translation being, if an elective surgery does not have to be admitted to the hospital afterwards, they can still be performed.
Hill says the scarce resource during this pandemic is a hospital bed, not the operating room. Eugene Cho, KXAN News.
And as of yesterday, about 70% of staffed beds and ICU beds at Ascension Seton, Baylor Scott and White, and St. David's were full. We presume that level of activity would require retention of the bulk of their staff, but those hospital administrations did not answer our questions today about staffing levels.
Another record-breaking day for COVID-19 case totals in Texas. Statewide, there were almost 6,000 new cases reported in a single day. So the governor hit pause on his phased-in reopening plan. That means businesses are able to continue operating in their current capacity until further notice.
So we have been progressing with opening things up, such as expanding the capacity of restaurants, for example, expanding the capacity of retail, for example, and over the course of the past week, literally, there's been an explosion in the number of COVID-19 patients. We simply cannot accept this dramatic increase in COVID-19 patients because pretty soon it could begin to overwhelm our hospital capacity. We cannot allow that to happen.
Abbott is also continuing to urge Texans to wear face coverings in public.